My name's Catia. I'm going to be doing my wound assessment, my wound care validation video. I'm going to provide privacy and introduce myself. My name's Catia. I'm going to be a nurse today. We're going to go ahead and change the dressing on your wound. And are you feeling any pain today? No. All right, thank you. I'm going to go ahead and identify my patient, name and date of birth, using 2 identifiers. All right, so I'm going to go ahead and wash my hands, gather my supplies, and come back and we're going to go ahead and get this done for you. I'm going to raise the bed to a working height. Make sure that the head of the bed is down. I'm going to go ahead and assess the wound and check for any bogginess. I'm going to assess the color of any drainage, the amount of the drainage, type of drainage, as well as the smell. Only exposing my patient as much as I have to. Prepare an area for trash. I'm going to hold the patient's skin down while I go ahead and remove the dressing. Okay, I'm going to go ahead and remove the gauze that is currently in the wound and count how many there were. According to the chart, there were 2 placed in. I want to ensure that there are 2 taken out. I'm going to go ahead and inspect for any granulation, palpate for any tunneling. So I want to ensure that I don't feel any bogginess. I'm also going to measure the wound, the length, width, and the depth. The chart says that it was measured in centimeters. I'm going to go ahead and ensure that it is again measured in centimeters. Without touching the wound, this is approximately, it is 14 centimeters long. It is 2.5 centimeters wide. And now I'm going to go ahead and check the depth. With this sterile cotton tipped applicator. Without touching the wound, with my hands, measure the depth. And again in centimeters, and it's approximately 2.5 centimeters in depth. So now I can go ahead and remove my gloves and I'm going to set up my sterile field. And I won't be needing that, so I'll discard that. And acknowledging that I have a 1-inch border. And now I'll discard the contents onto my sterile field. I have a bottle of normal saline. I'm going to ensure that it has not been opened in the last 24 hours. If it had been open, I would lip it over the trash to ensure that it doesn't contaminate my sterile field. When pouring, I'm going to make sure that the label is against the palm of my hand and I am 4 to 6 inches above the container. I'm now going to don my sterile gloves. I can go ahead and arrange my sterile field, making sure that I maintain a 1-inch border. All right, I'm gonna go ahead and prepare my gauze. A little difficult with gloves on. Fluff it. Put it into the normal saline. And because there were 2 that I took out of my patient's wound, I'm going to be replacing them with 2 more. Okay. Now that I've gotten that done, I'm going to go ahead and clean the patient's wound without turning my back to my sterile field. I'm going to clean from clean to dirty, top to bottom. I'm going to start in the middle in a twirling motion. And now I'm going to do the side in a twirling motion, clean to dirty, top to bottom. And the other side. Again, clean to dirty, top to bottom. Okay. Now I'm going to go ahead and pack the wound. I'm going to ensure that without touching the patient's skin and only the inside of the wound, that I am able to pack it with 2 gauze. I also want to make sure that my sterile field doesn't get wet. Otherwise that would break. My sterile field. Okay. Now that my wound is packed, I can go ahead and, these are dirty, so actually these can go right there. This hand is now clean, this hand remains sterile. Go ahead and cover my patient's wound with 4x4 gauze. And cover the wound with the ABD pad. At this point now I can remove my sterile gloves and the procedure becomes clean. Now I'm going to tape the pad in a window-like fashion. And I'd also label another piece of tape noting my name, date, and the time that the wound dressing was changed. Place that and cover my patient. Clean up my area. Bring them back down. Give my patient their call light and ensure that their needs were met before I left the room.